disease. So what? Why do I need to do this research? The behavioral problem of adherence to sickle cell preventive practices can actually be tackled by motivation, both social and personal motivation, and self-efficacy skills of people living with sickle cell disease. In practice, an informed and motivated sickle cell youth with good self-efficacy skill will adhere better to the sickle cell crisis preventive practices and enjoy improved quality of life. That young man would not have lost his job if he had actually kept to the preventive practices. However, despite the limitation, this study added to knowledge and validated the IMB model on sickle cell disease crisis prevention among youth. This study also has implications for policymakers, for research and practices. Is actually a useful tool for public health intervention. The information, motivation and behavioral skill model specifies that motivation acts as a catalyst to enhance health-related behaviors and determines whether even well-informed individuals will be inclined to undertake health promotion actions, which of course is the goal of public health. Patient who is well-informed and well-motivated but however lacks critical behavioral skills may be less likely to achieve or sustain high levels of adherence. The IMB model, of course, has been used with other youth population. This is indicated in the references, and the results were quite promising. This research is a step towards developing a culturally specific IMB model of sickle cell disease crisis risk prevention, and findings have implications for policy, research, and practices. The method used in this research is a cross-sectional descriptive study, which was first of all pre-tested and validated. It was a 43-item questionnaire was administered to consented 84 participants to evaluate crisis risk prevention information, motivation, self-efficacy skills, and adherence behavior, which were measured on a 10, 36, 15, and 21-point scale, respectively. Correlation and regression analysis was used to test for association significance and prediction of best pathway to adherence with a cutoff set at 0.5% level, 0.5 level of significance, that's 95%. The result. The mean age of the sample was 20.07 plus or minus 6.28, with 40.5% being male and 59.5% being females. The majority were Yoruba, of course, since we are the southwest of Nigeria, and they were single with minimum of secondary school education. Of course, there was an inclusion and exclusion criteria. Only educated samples were involved in this study, and also it was administered to the sickle cell club because it may not be easy to get a sickle cell person working on the street. So the work was restricted to the sickle cell club of Abeokuta. The main score of sickle cell disease risk preventive information was 7.93 over 10. That's quite high. Motivation responses was 30 out of the 6, and self-efficacy skills was 11.8, which were quite high when compared to the total score. The mean score of adherence behavior, 11.23 plus or minus 3.3, was just above average. Motivation is significantly associated with self-efficacy skills and adherence behavior, while information was not significantly associated with either. This points to the fact that even with much information, if you are not motivated and you don't develop self-efficacy skill and your positive behavior, you may not be able to adhere. Part analysis predicted motivation as associated with self-efficacy skills and adherence behavior. With these results, we will see that motivation is actually predicting almost 34% of the behavior and the self-efficacy. Self-efficacy skills was predicted by about 33.7% of motivation, and adherence behavior was predicted by just about 3.9% of motivation. Discussion. Adherence behavior is mostly predicted by motivation, which in turn was highly predicted by self-efficacy skills. The contribution of information to the crisis preventive behavior is very small from both parts through self-efficacy and direct part to adherence from information. The resultant effect from information and motivation is also low, This suggests that motivation is the stronger predictor of self-efficacy, which is responsible for the adherence behavior. This result, however, is consistent with the report by Mitchell et al. Of 2013, Zhu et al. 2013, and Joglin et al. 2013. All are appropriately referenced. The study results has provided validity for the theoretical and conceptual framework, that's the IMB model, that guided this study, and they have implication for policy, further research, public intervention, and practice. Conclusion. Findings of this study using the IMB model indicated that self-efficacy skills and motivation were both predictors of adherence to crisis preventive practices. In practice, an informed and motivated sickle cell youth with good self-efficacy skill will adhere better to the crisis preventive practices. Cross-sectional methods are limited, however, in the assessment of developmental processes and trajectory. Hence, future research is needed to explore the predictive power of the IMB model with specific racial and ethnic groups of Nigerians youth. Other factors involved in adherence to preventive practices should also be investigated, since motivation is just predicting about 37% or thereabout, using other theory and concepts with focus group discussion. I believe that with focus group discussion, we'll be able to have more information and the factors. These are the references. Thank you very much.
Thank you, Ms. Elizabeth. That was a good one. Okay.
Thank you.